It is approaching time for morning rounds at a local community health center where a social worker, a physician assistant, and a nurse are about to meet to discuss the week's cases. One of the many patients that week is Mr. Jones.
So one of our patients this week, Mr. Jones, is pretty complicated. I brought my notes that I took after my visit with him. He's newly homeless after having lost his job. He reports transient blurred vision, trouble understanding softly spoken speech when there's background noise. He's got ringing in the ears, tingling feet, and an unsteadiness while he walks. He's lethargic and displays little interest in activities at his shelter. In fact, I had a hard time enticing him to do any activities or socializing at all. And I'm thinking that part of this lack of interest could be because of his untreated hearing loss.
Yeah, that's pretty consistent with what I observed during his physical assessment. Thanks for sending him over, by the way. I observed fine tremors in his hands, occasional body shaking, and a pretty unsteady gait. He wasn't exactly communicative or cooperative during the time that I was meeting with him, and he definitely had difficulty hearing what I was saying.
He complained to me of fatigue, loss of appetite, and many other nonspecific symptoms that led me to believe he has depression.
Yeah, I did notice a number of unhealed wounds, and I'm not certain if those were self-inflicted or if they were just from him being out on the street. He did indicate that he was in a fair amount of pain from that and asked for some medication to help with that.
He allowed us to take his blood pressure, and I have it here. It was 150/82, but he wouldn't allow us to take any of his blood for blood samples.
So I was able to ask him about his insurance, and he used to have insurance through his employer, but when he lost his job, he thus lost his insurance. I asked about his medication, and he said he does take some medications, but he could not remember any of the names or the reasons why he takes them.
Well, I think we have enough issues here that we need to have a team meeting of the clinicians at the center. I would be happy to set up the meeting and take the lead on the meeting if that's okay with you.
That'd be great. Thank you.
A follow-up meeting is held at the community health center with the nurse, social worker, and physician assistant in attendance. Joining them today are an audiologist, an optometrist, and a psychologist. The nurse, as the team leader for the care of Mr. Jones, opens the meeting by giving a brief summary of Mr. Jones' history and initial clinic visit.
Thank you all for coming. The goal for today's meeting is to formulate differential diagnoses and short-term care needs.
As I'm sure you know, diabetes can lead to hearing loss. Diabetes can also cause peripheral neuropathy, which can lead to unsteady gait. There are many medications that cause side effects that include hearing loss, ringing in the ears, and balance issues. So either diabetes or polypharmacy could be contributing to his difficulty hearing, the ringing in the ears, and the unsteady gait. It would be really helpful if we could get more information about his medication history. Additionally, any untreated hearing loss can lead to isolation, which can cause depression. So I recommend that a hearing evaluation be included in his plan of care.
You know, transient blurred vision is a typical symptom of poorly controlled diabetes. So I would recommend a dilated fundus examination to evaluate if there's any eye health risks, such as diabetic retinopathy, that can affect vision. How likely will Mr. Jones remain at the shelter and commit to following through on all these appointments? I have a long waiting list.
But Mr. Jones needs our full support now. It's the only way he can become employed again.
Well, I only asked to see if we should do as much as we can on one visit or spread out his appointments over time. It's a lot for one person to go through a single appointment.
Given the concerns about depression, I would be willing to see Mr. Jones at a follow-up visit that could be coordinated so he could see multiple providers at the same time. I would also ask that the team huddle before and after the visit. This is a complex case with many needs, and it is vital that we get together so we don't miss any information.
Again, I really appreciate what all of you are offering to do today for Mr. Jones. However, I think we need to take a step back. Remember, Mr. Jones did not even want us to draw his blood. So if we do not include him in his own plan of care and help him to participate in decision making, none of this might work at all.
That makes really good sense. I think we got ahead of ourselves. Thanks for the reminder for us to get Mr. Jones' input as well.